All right, well, hello everybody. Haven't been here in a while, have we? I want to welcome you all to Aldea. I think before this presentation we were talking, this is the first in-person roundtable at Aldea in 2 years, thanks to this thing called COVID. But that's what we're going to talk about today, because this is the State of COVID-19 Roundtable and Vaccinations in Philadelphia. I first want to thank you all for showing up, and our panelists, and our sponsors, Philly Counts and the Philadelphia Department of Health, for making this possible. If all goes well, this will be the longest I'll talk the whole time. Today our discussion is about the ongoing battle in Philadelphia and beyond against COVID-19. It's a virus that's enveloped our world over the last year and a half, but unlike a year and a half ago, there is some light at the end of the tunnel, thanks to vaccinations and our slowly reopening society. Philadelphia is one of the nation's leaders in getting residents vaccinated. Round of applause for that. Hitting almost 70% partially vaccinated for its population a few weeks ago. That being said, there is still a lot of work to do to get everyone vaccinated. And that is part of what this discussion is going to be about today, specifically at parts about getting Latinx communities in Philadelphia vaccinated. Today we'll talk about what those efforts look like getting those communities vaccinated, efforts from the city, efforts from its community partners, along with some of the developments of COVID-19 itself, such as the Delta variant, which I'm sure some of you have heard about. We'll talk more about that. People here today can also expect to hear some conversations about getting children vaccinated, which is another late development of the last couple months for COVID-19. But for that, my name is Nigel Thompson. I'm a deputy editor at Aldea, and I'm going to introduce our panelists now. So to my right, we have Joanna Otero Cruz. She's the Managing Director of Community Services at the Managing Director's Office of Philadelphia. To her right, we have Marianne Salib, a doctor of osteopathic medicine at Esperanza Health Center. To her right, we have Alexandra Thomas. She's a registered nurse at Congresso Health Center. And to my left, I have Julian Rivera Ventidos, prevention manager at Kalei. To his left, we have Vanessa Caracosa, director of partnerships at Philly Counts, and in the city of Philadelphia. And to her left, we have Manuel Delgado, the COO of Asociación de Puertorriqueños en Marcha. I can't believe I just said that. APM. Welcome, everybody. Thank you so much. And I want to open up the questions, talking about something that I mentioned in the intro, and I want to talk to Marianne first, the doctor in residence, the doctor here, talk about the Delta variant. We've heard about the Delta variant for probably the last month and a half. I think the first thing I want to ask you is and for our audience, is what is this Delta variant, and how did it come about, and what should we know about it?
Sure. So, yeah, I mean, we've been hearing all about it, and this isn't the first variant we've heard about, and this is not uncommon to viruses. This is what viruses do. They mutate. So this is not unexpected that we would see variants. There have been several variants. We heard about the Alpha variant that was of great concern in England. And now we have the Delta variant. And so we're kind of going through the Greek alphabet, which was the recommendation of the WHO, rather than labeling them by the country that they started in. And so the Delta variant is of particular concern because of its transmissibility. And that's what classifies a variant as being of concern, is that when it is much more transmissible. And what we're finding is it's about 50% more transmissible than the Alpha variant, which is 50% more transmissible than the original virus that we saw last year. So that is the concern, is that it is much more transmissible. Fortunately, we are finding that the vaccines that we have are very effective against them. However, the concern is that one dose is not sufficient. And so it is very, very, very important that everyone who has received their first dose gets their second dose, and that if they haven't been vaccinated, to be vaccinated, fully vaccinated, which includes 2 doses for Moderna and Pfizer and 1 for Johnson & Johnson.
And speaking of the vaccine's effectiveness on them, you said that they're still effective at keeping people out of the hospital. Does that differ among the different vaccines, or I'll just stop there, or anything else about the vaccine's effectiveness against this variant?
Yeah. So the good news is that the vaccines are very effective at our primary goal, which is preventing death and hospitalization. We are seeing that likely there is a bit of a decrease in the effectiveness for just symptomatic infection, but we knew that COVID wasn't something we were going to eradicate completely. But we wanted to get to a point where this wasn't something that would put our world to a halt, that would end many lives and lead to many people being hospitalized. And so the vaccines, all three, are still very effective at reducing chances of hospitalization and death. There may be a slight decline in symptomatic infections, but again, this is only when persons are fully vaccinated. We're seeing differences of even from 30 to 80% difference between a single dose versus 2 doses. So very, very, very important that everyone is fully vaccinated.
Mm-hmm. And my next question about the Delta variant, I want to open up to kind of anybody who wants to answer, because we've obviously in the news and in leadership positions have heard about the Delta variant, but I want to hear what are kind of, especially from potentially their community partners or leaders in the city, what have you heard about like the attitudes in the community, especially Latinx community, about the Delta variant? And I can open up.
I think unfortunately there's a part of the population that believes we're on the downward trend of the pandemic, and they've sort of made it through the peaks. So they were very instrumental in getting their parents or their grandparents vaccinated, but now are just sitting back and saying, this is almost over. I didn't need to get vaccinated. I won't need to get vaccinated. I'll just wait this through, which I think could potentially cause another tiny spike in the fall.
Anybody else?
I've also heard that a lot of people are just waiting for the whole household to be able to go together and get vaccinated. And so it's almost like if my kids can't get vaccinated, I'm gonna wait and hold off until then, not realizing that they are bringing a level of prevention to the home if they get vaccinated, at least if their children are not of age. So I definitely hear a lot of that. Actually, recently we were just at a vaccine clinic, and I think we all were trying to convince some individuals to just make an informed decision and how important it was for their kids. And they were not budging simply because, again, they wanted the whole household to be vaccinated.
Right. So I think that transitions into the next section very well. And I'll pass it on to Alexandra, specifically about getting children vaccinated from COVID-19, getting COVID vaccines. Is that something? I mean, obviously, Joanna just mentioned it's something everybody's recommending. What should people know about getting their children vaccinated?
So we tell families is the vaccine is what's gonna get us out of this mess that we've gotten into. And what I do tell them is, this is not something that was put together from one day to the other. It's been going on for years. These new technologies, it's just thankfully it came into place when we needed it the most. And the regulations that we have to go through for a vaccine to get approved, even if it's just an emergency approved, are so rigorous that the FDA have considered and the CDC, they have considered it safe and effective for children, which means it is okay to vaccinate your children. And with that, you're not only helping your own family, but also the broader community with it. The fact that we vaccinate people, it's only not, like I said, not saving just your family, but stopping new variants. And children, even though they are less vulnerable, yes, they're going to be most likely less sick, or there's less hospitalization with children. They can get complicated, they can get complications like the multisystemic inflammation syndrome, which can be deadly. And yes, it is rare, but it could happen. So why not save them from that, instead of taking your chances to have your child be hospitalized, or let alone, having to die. So it is crucial for everybody 12 and up to get vaccinated and know that Pfizer went through all the steps to make sure it is safe.
Right. And obviously, Johnny, you shared your experience of getting of trying to convince people to get their kids vaccinated. Does anybody else have any other examples of that, or approaches that you take for somebody who may be hesitant about getting their children vaccinated?
I think we've seen a little bit of the same. We've ran a couple of clinics on Saturdays where you actually had to be scheduled for the vaccination. And even those people coming in, you had to convince them to actually follow through with it. Some of it was fear of the illness that might come afterwards. So I have to work this week, it's Saturday, I might feel good tomorrow, but how am I going to feel Monday, Tuesday, Wednesday? I can't miss work. And then some of it was just, I'm not 100% sure and I'm just going to walk away now. I know that the opportunity will be there in the future. So we've seen a little bit of that as well. I mean, we've tried to talk people through that, as you have. Sometimes you win it, sometimes you don't. But we keep offering the vaccine so that hopefully it's not a one-time event. Hopefully there's something else, another conversation that sort of brings them back to the table. So we're continuing with the vaccinations and hoping they do come back either to us or to another group.
Last follow-up on that. Is speaking of the ones that it does work to get, like, it does work in terms of convincing them to get a vaccine. What approach did you take in that moment, and what did you do?
I think it's just honest conversation, to be honest. Like Alex was just saying about giving them information. Sometimes they have specific questions, a lot of questions about, the technology or the fact that they think it was just manufactured, in a week's time, and just, kind of dismissing those myths, but just really having honest conversation, not pushing it. It's really their decision to make and respecting that space. I think has been what's worked. Sometimes they'll walk away a little bit and come back and ask additional questions, but I think respecting that space, that it's their decision, I think is really important.
If I can add to that, I think also a big part of that is listening, to their story, to their concerns, giving them the information that they ask for, answering their questions if you do know the answer to, or just directing them to their health provider, to their doctors, to make sure that they are making the best decision for them, because we understand that people do have legitimate concerns around health and issues that they have that they should privately discuss with their healthcare provider. That way, not only can they reach a decision to maybe get vaccinated, but also decide which vaccine is best for them.
And again, hi everyone. I'm Jorian Rivera-Mentidos. I go by they, he pronouns. I'm with Kalei. So Kalei on June 5th hosted their first COVID vaccination clinic, and we got the community to come together. And I'm going to piggyback off what you said and piggyback what you said. Kalei was very intentional with community, so we went door to door, we did our outreach, we walked in the blistering sun, we walked all the way to Girard Station, all the way to Huntington Station, and we made it very intentional. We here's a pamphlet, we're doing testing from 9 to 5. We had a lot of couples come in. There was one gentleman who was very hesitant, only spoke Spanish, got the services. He said that he was going to talk to his wife. Maybe an hour later, he came by himself, and then his wife came hours later. And then we also went ahead and spoke with another gentleman who was really eager to get the vaccination, but their boss would not allow them to take their 15-minute lunch break or be able to take that time to go get the vaccination. So we went ahead and did the vaccination at their job and did the observation while they were working. So I feel like we have to be intentional, like y'all said, to move forward, but we also have to do the frontline work that comes with it, and that's meaning where they're at their homes. If we have to sit in their homes and do it while they're there because it makes them feel more comfortable, then we will do that. And that's something that we all collaboratively, you said we all have seen and started working together. And so that's something that Kalei has collaboratively worked with the community to try to push that narrative. And we gave away Moderna and we gave away Johnson & Johnson. And we make sure people have that option, like you said, that opportunity to take the responsibility.
Awesome. Well, I think I'll move on to my next one, and this is another one that I think, again, as you say, like as you said before, people are, as Manuel said, people are often still think we're past it, and I think a big part of this too is the whether or not to keep a mask on when we're in places, and I want to direct this at Marianne. If someone is vaccinated, say you're vaccinated, should you still wear a mask? What is your stance on that, or how should people navigate that?
So the CDC has said that if you are fully vaccinated, which means that you've received 1 dose of Johnson & Johnson or 2 doses of the Pfizer and Moderna, and you're 2 weeks away from that second dose, then you are considered fully vaccinated, and you do not have to wear your mask. There's certain areas that they are still recommending that we wear masks, and then that would include public transportation, like if you're on the bus or SEPTA, or in airports, places like that. Also in healthcare settings, long-term care facilities, there are some areas like that that would be recommended to still wear a mask. However, with things may change. We've seen that in the WHO, they're starting to recommend wearing masks again, and that's why it's even more important. We need to be continuing to vaccinate, or else we may start seeing our mask guidelines changing. And of course, whenever you're around people you're not sure that they might be vaccinated, or you feel more comfortable wearing a mask, it never hurts.
Does the city have any sort of stance on, or is the city following the CDC too in that sense?
At this point, we're following the CDC guidelines, just as mentioned, right now. So for some places, like where there is residential, settings, in terms of like with youth or prisons, they're still, doing masks. But other than that, it's just the CDC guidelines.
Gotcha. Anybody else want to talk about masks? Anything?
I just want to add, I think it's the individual decision to decide if they're fully vaccinated, whether or not they still feel comfortable or not. There are times where you go to maybe a supermarket and you feel a little congested by people, and you feel, so if you feel that it will protect you and you feel much more calm, I think it's their prerogative to do that. So again, and I think in all approaches is what we're saying, respect the individual's decisions, and really giving them the tools, the education, so that they can make an informed decision about. Now, I carry a mask all the time because if I feel uncomfortable, I'm going to wear a mask, even if I'm fully vaccinated, as I would, my fellow, colleague or partner. And if you're in enclosed spaces, you might feel different than if you're outside, So I think it comes down to the individual.
Gotcha. And I know another thing, we hear a lot about when it comes to the vaccine is this thing called community immunity. And I think I'll direct this question at Vanessa. What is community immunity?
Mm-hmm. So community immunity is when a large portion of the community becomes immune to a disease, which means that the spread from person to person is very unlikely. So that means if, it's very unlikely, and then, the whole community comes immune. And I think, you hear this number 70% from doctors, from scientists. It's just the most common number. And that's why we chose it as a goal. But we are working to make sure that every individual has the information they need, has the access they need to access a vaccine.
Gotcha. And I mentioned in the intro kind of where Philly is on that scale, but where are we in the sense of, where are we in the sense of community immunity right now?
Yeah, and as you mentioned, we are the largest city in the country that has the highest vaccination rate. At the same time, we still have neighborhoods that are lagging behind, and that's where, Philly Counts works with community partners like the ones you see here, and we're really trying to work collaboratively, and also with the health department to make sure that we're focusing additional resources and just working really strategically to make sure that the vaccine is accessible in every neighborhood. So that way we don't just have like a whole, over 70%, that's great, but we know that there's still much work left to be done, especially in communities of color.
Gotcha. And I guess I'll jump to that. Can you talk a little bit about what the Philly Counts effort is to get people vaccinated, and after that you can expand upon just any other efforts the city's doing to sort of make that happen?
Yeah, so Philly Counts, our team is charged with working with community leaders, community-based organizations to build networks around the city to make sure that people have the information they need, that people have the access they need if they do decide to get vaccinated. And we're working closely in, like I mentioned, in low vaccination areas. So we're constantly, communicating with the health department and seeing where we stand in vaccination ranges. That way we can work strategically on a grassroots effort to really reach community and raise those percentages in the neighborhoods that we are seeing that are lagging behind or are not changing. And that includes, lots of conversations. Just to quickly go back, around, what it takes to, convince. I use convince, but really it's having lots of conversations. It's likely not to take, one conversation to help a person reach an informed decision. It's going to take multiple conversations, and it does have to come from different people. It could come from friends, family, neighbors, healthcare professionals. And I think that, collaboratively we can do that in order to reach community immunity.
Right. And I know you had the vaccine champion kind of program. You kind of took the census champion program and made that happen. Talk a little bit about that.
Yeah, so the Vaccine Information Champion training is a training that gives people the tools that they need, information they need, background about the virus. So you heard our medical professions talk about that. The coronavirus has existed for many years. It did get strong, and that's why we are here now. And also, it talks about how the vaccine was developed. Why was it developed so quickly? It dispels myths that we're hearing, in the community. If I'm pregnant, can I get vaccinated? Does it affect my immigration status? So it just really is a well-rounded training for individuals who do want to be that resource to others, to have the information that they need to have that conversation. And I do want to add, we work with organizations to host those. So we are, our office is open to work collaboratively, so we can bring these trainings, not only virtual now, but into the community.
Mm-hmm. And I'll shift to Joanna. Obviously Philly Counts is kind of leading the charge on it for the city, but like specifically for like the Latinx community, what are some specific things that the city is trying to do for that?
Yeah, I definitely want to echo. I'm a fan of the ambassador program because it's your neighbor, who's being trained to kind of be that champion and that cheerleader for the vaccines and can really accompany people throughout the way, right? But the city acknowledged that, we were going to need a multi-pronged approach, right, to ensure that everyone gets information. So from the very early onset, it was important to make sure that we're able to communicate in multiple languages. For the Latino community in particular, Spanish, was key. So every press conference, hopefully if you chimed in, you knew that we did it bilingual. But that wasn't enough, right? Because we know that we are very strong on radio still, so we had to utilize multimedia platforms to get the information out, as well as the literature that's being disseminated to all of our partners, making sure that it was bilingual, everything was translated, a website. So if you go to our website, that it is translated, not just in English and Spanish, but in multiple languages for our immigrant communities that help this vibrant city be what it is. So that was really, really important. We also were hearing from communities, so listening is something that we, oftentimes people say, critique is bad. I love critique because they keep us on our P's and Q's. Really, community holds us accountable, and I think that's really important. We started hearing from community members that 311 was not being responsive to our Spanish callers. And so we had to reposition and reactivate and create what we call Service Hub so that we can direct those calls directly to a service agent that spoke in Spanish, because people don't want to wait. Even if you're down to like half a minute, people do not want to wait. So it was really important for us to listen to those comments and criticism to make sure that we adjust. And extending the time, for example, because we know that many of our Latino communities oftentimes have those essential jobs, right? So they weren't listening to a newscast or anything like that, but they could definitely, call. And so we made those adjustments. And as already mentioned, partnership was the most. Part of Philly Counts, and I have the privilege to have them within my portfolio. So we spend a lot of time really thinking about how do we do coalition building, because that's really what helped us get through the census, right? It was coalition, it's the grassroots effort, people like the APMs and Esperanza, Congresso, Kalei, who are already doing the work, who already have the trust of community, who already have a clientele. It was those individuals that were really going to get us to the next round. And it was taking it facet by facet, right, at that point. So not just, whether it was providing grants or, opening RFPs, really advocating so that there is equal distribution for geographical serving areas, all of those things that aren't necessarily always in the public, but those were really, really important and core to us paying attention to what was happening. And again, making things as transparent as possible with the use of utilizing multiple platforms, so that individuals had the education, are some of the efforts that or strategies that we were able to implement.
Right, and I think my next question kind of piggybacks off of that. I mean, you talk about the necessity of partnership in tackling something like this. So I want to direct my next question to the representatives here that are from those community organizations. I'll start with Jorian. What is the message now? And we'll go Jorian, and then Manuel can talk, and then if Marianne wants to talk about Esperanza's efforts, and we can go in that direction. But back to the question: what is the message now? What does Kalei's efforts look like now? You mentioned before, kind of going door to door. Is it more of that, or is it any other different approaches?
Kalei is all about having different avenues of approaching to certain things. We believe in there's a solution for everything, and we're going to always find a way and tackle this, get that solution. Kalei was fortunate to host their first vaccination clinic, and then we partner with Prevention Point, where they host vaccinations every Tuesdays and Thursdays between 12:30 and 3:30, and they do it for free every day. And I believe they give away Johnson & Johnson, Moderna as well. Anybody who comes to our location that are looking for HIV testing, STI screening, youth services, teen services, we always push that narrative as well. Like, hey, if you're looking for COVID vaccination, this is where you can go to get those services, and it's always in walking distance. And Kalei will always be more than welcome to walk with that person to make sure we are there to support them through and through.
Cool. Manuel, what do efforts look like at APM for that?
I think our efforts, like ACE and Esperanza and Congreso and some of the other organizations, are more community-based and really stretch out beyond just the vaccination piece. So making sure that families are stable, right? So a lot of people lost their jobs or are underemployed currently. So making sure that they have the rental assistance, the shallow rent assistance, anything that they need with that piece. Helping people with food programs, helping people through our FOC, through stabilizing families, through the socioeconomic piece. And then on the vaccination side, we are having vaccination clinics every Wednesday. We were able to partner with Temple University to do that. So that is going on every Wednesday at our Rising Sun location. So that is still available for folks. But we've just taken a whole community approach, because this has impacted people in so many different ways. For entrepreneurs, we were able to get some grant assistance to help keep them whole during the pandemic. And there's 1,000 different examples. With schools, we had to go totally virtual platform, but still be engaged with parents for our pre-K program. So that was very difficult, but we've made it through that and have learned valuable lessons through doing that. So we've just had to really pivot in multiple ways to make sure that pre-vaccination and post-vaccination, we're still addressing the needs of the community.
Marianne, I don't know if you want to add anything for what Esperanza is doing. I feel like Manuel talked about the community approach. I'll yield back.
Sure, I'll just add briefly at Esperanza Health. I think I'll echo the importance of partnerships. We definitely saw that this past year. Couldn't have made it through everything this past year with the testing and how we cared for staff without the partners that we had. But also, the importance of pivoting, and now we're trying to figure out how to be more creative in how we present our offer of vaccinations. We're still offering vaccinations at 2 of our health centers every day, and also on 2 Saturdays a month. But we're trying to explore, but as across the country, demand has declined, and so we're trying to figure out how to be creative about it. And we also have a COVID ambassador program as well, recognizing the importance of the message being given through people who are from the community, and how sometimes that's much more effective than someone in a white coat or someone who, though of course the voice of the health professional is important, but it's very different when it's someone who's your neighbor, who understands what you may be going through. So.
Gotcha. Alexandra, if you wanted to add anything for what Congresso is, what the efforts at Congresso look like going forward.
Yes, so Congresso is vaccinates from Monday through Friday from 8:30 until 5 every day. We have vaccines. We are now administering Pfizer so that we are able to reach children 12 up, but we also have Moderna to finish up with second doses needed. We do have 2 nights a week and 2 Saturdays a month, and that's, unfortunately declining, because it's not, there's not enough people. But if there is the need, we do work 2 nights a week and 2 Saturdays a month. And then also I think that for our community, little things just like this, that we wear our pins saying, I am vaccinated, I am you, I am Latina, I am part of the community. And people like to see their doctors, their nurse practitioners, their physician assistants getting that they got the vaccines, because now they trust. They know, well, if you got it, if you vaccinated your child, then I'm going to vaccinate my child too. So we make sure we tell them, yes, I got it. I'm here. I'm okay. My child got vaccinated and she's okay and he's okay. So how about yours? And so I feel like making them know that we are community too, that we are Latinos, and that we, it's safe for us, therefore it's safe for you too, makes them feel more comfortable to get them.
We're getting to some of my last questions, but speaking of speaking of the need to get vaccinated, if, say I'm somebody who hasn't been vaccinated, what's the first thing I should do? Like, what should I do if I'm not vaccinated? Like, who should I go to?
I feel like primary care is going to be the first person that's going to, be able to guide you. Now, thankfully, that now even you can go grocery shopping and you can get the vaccine. But if you have questions about it, your primary care doctor is going to be the best person to address. So I know there are some medical situations or conditions that will prevent you from taking the vaccine, and therefore it is important for you to address that with your primary care doctor if needed, with your specialist, with your oncologist, cardiologist, you name it. There's so many specialties that can be part of this, but the medical professionals are informed. They know what's okay to do, what's not okay to do, so they will be able to guide them first. But if there is no medical questions, you can go pretty much anywhere nowadays, thankfully, and get the vaccine anytime, anywhere.
Awesome.
I would just say a quick number to remember is 311, because some people don't have a primary doctor, and so they don't know necessarily, and we hope people know, like you can go to your local Rite Aid, CVS, but sometimes people don't know where to turn, so 311, it's quick, they can tell them where to turn, and depending on where they're living, they can tell them, they use geographical maps and make sure that, hey, these are your options, whether they need an appointment or not. Most places don't need appointments right now, so again, that's a real quick number to remember. Call 311 and they can guide them in that direction. That, as I always tell people, you can always go to your local pharmacy. There we have over 120 besides the CVS and Rite Aids. They're privately owned, and they're really community-based. Our website is also really good, phila.gov /COVID. But again, sometimes people just want an easy call.
If I can add to that, there are over 270 locations in the city, both that are run by the health department and also by partnerships. And all Philadelphians, again, are eligible for vaccination as long as they're 12 and up. And you can find those sites at phila.gov /vaccines. And another thing to know is that you can, change the language to our site to Spanish and any other language that you might need to connect to the closest vaccination site. And as Joanna mentioned, there are a lot of walk-in appointments now in a lot of places, but there are still opportunities to schedule an appointment if you need one. And also, one of the services that the city is now providing is in-home vaccination services. They're available for homebound individuals, which is really important.
Cool. Yeah, I think my last kind of question before we wrap it up is specifically to the Latinx community. I mean, we had talked before about how we really need to put a lot of effort into getting them vaccinated because the vaccination rate is low. But I think Manuel touched on it too. It's so much more than just getting vaccinated. It's how much it affected these communities economically, with jobs, with food, with anything. So I just want to throw the question out. What more work needs to be done to kind of support not just the vaccination effort, but like recovery efforts in general, just economically, entrepreneurially, things like that.
Yeah. Do we have a couple more hours?
I know. I feel like it could be a whole other one.
The reality is there are multiple efforts going on, as Manuel said, throughout the, which is why we need our partners. Everything from, now with the more moratoriums going up, people are behind with your utilities, in addition to rent. So just economics all across the board. And so while we definitely have been, focused on getting people tested and vaccinations, all of these other efforts have been going on to support the small businesses. Many of them struggled. Some of them, did extremely well, but others did not. So, getting low financing or grants available, all of those things that took place and the millions of dollars that went out, it really was in partnership with our CDCs and our nonprofits to be able to, some of these applications, anything from the federal government could be very complicated and complex, even in your native language. So needless to say, so that continues to happen. Manuel mentioned the schools. That was, we have, we have lots of Latino-based charter schools who've had to also just convert. Our foster care kids, who like APM, they had to kind of pivot and see how can we accommodate that. It's such a different, task for a foster parent to have to do. I can only imagine. So all of these multifaceted, what I call the social, ills that we have to address, was something that was ongoing throughout the pandemic. It didn't stop. The city, I had to activate 40 food access centers. I was charged with a warehouse, so we all pivoted. And so where we had 130,000 feet of just warehouse to be able to not just pack the food, but disseminate the food into 40 different distribution sites. The school district did as well for the kids. So, while those have scaled down, they're not gone. We still have in the upwards of 52 sites. They're just run through our Parks and Rec and through our partners of Philabundance and Share Foods, because we know that prior to COVID, we have extreme poverty in Philadelphia. Prior to COVID, we had food deserts. And that was just exacerbated by the COVID. It didn't dissipate. And so we knew that, our policy office evolved to make sure that we continue to address that from a standpoint of sustainability. So there's a lot of efforts that started or grew or, just went from slow to fast paced that continue today. We also saw a lot of health disparities, and we knew that they existed, right? You guys work in healthcare. We knew they existed. We've been screaming about it for years. We have great advocates in our organizations that have been screaming about it for years. And COVID actually, really put it in the forefront. So our health department has been working on how do we address that in full force. And so there are numerous different initiatives that continue still today, and we hope to continue, and hopefully some of them will remedy soon, and others we know are much more for the long haul.
I would like to add to that, because everything you said was amazing. I also want to be intentional on meeting folks actually where they are physically and mentally, because we are getting to a place where COVID is starting to become on the back burner, but still on the front burner. It's either left or it's either right, and it's either down or it's up. And so, as we transition into this life of normacy, as we are calling it, we have to meet people where they are. What have we missed over the year and a half that has been gone? We're missing the mental connection, the emotional connection, the interaction with folks, and how do we go back into the world and be interactive with people based on the conversations we had. So for us, for Kalei in general, it's about, one, we're going to meet you where you're at all given times of the day. If it's morning, midnight, the midnight hour, the witching hour, what you call it, we're there for you. And also we're implementing stepping outside the box and finding more creative freedom to actually physically meet these people. How can we be innovative and fun and accessible and still educate people on COVID and HIV and STIs and make it fun and innovative? Because doing the cycle of medical talking in medical terms, our community is not going to get it. We can talk the medical terms, we can provide long words and definitions, but our community is not going to understand that. So how can we come as who we are as Latinx, Latinos, as theys, as he's and she's and thumbs, and provide a space where, like, I am you, you are me, I am not in my work clothes, I am just a community member as you, and I would just like to talk to you just because. And let that conversation flow as naturally, because for me, people already set on the conversation. They already know what's going to be pre-existing. They already set themselves up for, like, cool, this is Kalei. They're going to come talk to me about HIV and COVID. I already know what this spiel is. All right, how can I divert that conversation? Because they already know what I'm going to come talk about. How can we be more creative and be like, I want to talk to you about COVID and HIV, but I don't want to give you the same spiel. I want you to have that conversation with me, and, like, I talk to you, but you come to me with the ideas. And I just give you that yes. So they're like, yes, you want to do that? I'm going to support you 100%.
Anybody else want to add anything?
Yeah, I'll add. So at Philly Counts, I think we're being very thoughtful around, what other resources can we bring to the community, and by that I mean, like, partnering with other, city offices that provide services to community, or community organizations that are already in the community if we're having a vaccination event. So really making it, a holistic approach where we have resources for people. For example, City ID is a big one where residents of Philadelphia are able to have access to a municipal ID, and there are no questions about Social Security, immigration status, and 311, Department of Labor, and just thinking about, like, working with organizations to figure out what resources does that community need where we're going to be at, so we could, if we're planning to bring vaccination, that could be an added thing as when they finish getting their ID, and maybe it's another opportunity to have a conversation with someone about deciding to get vaccinated.
Gotcha. Well, I think with that, I just want to ask all of our panelists, we talk about this, our whole conversation today was the state of COVID-19 and vaccinations, with a pivot towards looking towards the future. So I ask all of you, what is your message for the future? And we can start with Alexandra and just go around.
I feel like keep yourself informed, because that's going to help us move forward. The more we know about it, the better we're going to be, and knowledge is also going to help us get more people vaccinated, which is going to help us get to a better state. So just get the word out there, educate, meet people where they're at, and just be part of the community, because that's what they're going to trust more.
I think I'd say that we're in a place of a very delicate place where we're all very happy and hopeful, and I'm so grateful for where we're at right now, and grateful for everyone's efforts that have gotten us here, and grateful for everyone who's gotten vaccinated to allow us to get to this place. But we're also at a place where that could change, and so just encouraging everyone, recognizing that everyone has a voice and is important in this effort, that individuals talking to their family, talking to their neighbors, getting the word out and encouraging people to get vaccinated is just so important right now, because we could we could be entering into a fall that looks very different than where we're at now. And so it's just very important that, if people have questions, to ask them. I've recently heard the term, instead of vaccine hesitant, to use the term vaccine inquisitive, to recognize that people have questions and to respect them and to approach conversations humbly, realizing that, yes, this is new, this is different, but that there is good science to be trusted. And to just encourage people that we're all in this together. We can't move forward unless we're all, talking again about herd immunity or community immunity. We only got to this point because we all got together as a city, and we're not going to move forward unless we all do it together. So.
Kudos to both of you, because I agree with that. But I'm going to take a little different approach, and I think it's important that people do some self-care. It's been many people have been traumatized in a lot of different ways. We talked about, the economy, even school transitions, a multitude of different ways that people were impacted personally. And it's been a hard year, and I think it's important to acknowledge that it's been a hard year for everybody's been different, but, we had large unemployments, furloughs, you name it, right? People felt isolated more than usual, and mental health is real. Like, we all have that, right? And so I think it's really important that people do some self-care, that if they need support for their emotional well-being, that they reach out for help, and really begin that process of healing and recovery. I think it's really important that we all owe that to ourselves, and I think it's really important to share that.
Also, I'm going to add on to that and say, like, as we take this trip is focusing on our mental health and navigating these intersectionalities, I definitely would like us to definitely reach a place of consciousness and self-aware and knowledge, and then we lead that with no myths and no stereotypes, and that we see who we are and how we are, and we love each other unconditionally on how that looks.
Yeah. I would say to those who have not been vaccinated, I encourage you, to talk to your doctor, talk to your friends, talk to your family, seek the information you need, ask the questions. That way you can make an informed decision for you and your family.
Wow, last one. I don't know if I could add much more to that. I will say, though, just sort of the flip side of that is being thankful for this year as well. For us, it's been a pivot point, but it's also been a huge learning trip as well, which will help us in the future. I know Joanna said she likes criticism because it helps her grow. I think sometimes you need praise as well. And the way the city handled this, the way they moved this forward, the way they were able to take our advocate approach and not get upset, but actually push things forward, allow us to be creative with service delivery, was just amazing. So thank you for your work at the city and for allowing us to do that as well. So.
Thank you for your service.
Yep.
We'll enter the last part where we have questions from the crowd. I'm so sorry. Yes.
Hi, sorry to bring everybody back, but my name's Emily. I'm the Community Outreach Coordinator for Penny. We're the State Health Insurance Marketplace Exchange here in Pennsylvania. And I had not a complicated question, but I was wanting to get some advice or insight. So before I was doing community healthcare outreach, I was working for the Federal Department of State and Consular Affairs, and I found really all of the time that attitudes towards government, information, and trust of anything that was being said was almost like absolutely proportional to concepts like privilege. So if you're served well by your government, served well by your healthcare system, you were more open to believing what you were hearing. But I've done outreach at the Mexican consulate, and attitudes in that population there is that at home in Mexico we have this national healthcare system that we really trust and really like. Here in the U.S., it's more of a business model. So one thing with the Latinx community I wanted to ask about is just that whether people are immigrants now or second generation or have been here for a very long time, there's this opportunity to kind of leverage home country attitudes towards governments, and I guess the COVID responses that are happening there. So I wanted to know, how would home ties and home country responses to the COVID epidemic and people's attitudes about the governments where they have those ties to, how do those compare to people's attitudes towards U.S. efforts and federal and city efforts, and how can we maybe leverage gaps? In what ways are there successes and failures in Central and South America that we can compare to? It's like a complicated question, but I really could use some advice.
No, I think that's a great, excellent question, actually. And I think for us, it's been why I think working with coalitions of different, it was just about 19 of them, if not more now. But I think that's why it's been so important to work collaboratively, because conversations do come up about trust or distrust. And, oftentimes Latinos families, like many families, they're mixed statuses, they're mixed, races even, and so it's important to have forums that those dialogues can happen. And so by working, Philly Counts works a lot with the different nonprofits and faith-based organizations that, convene these groups that those dialogues can happen. And depending on what the topic, they draw out of that to really develop whatever outreach plan, which is why it's so neighborhood to neighborhood specific, and it's not regional, it's not citywide. It is very, sometimes it could be just a couple blocks, while others it could be a much bigger section of the city. But that has been our approach. I don't know if you want to add anything to it, but it's been working because it's something that can be discussed by community members, their differences, their beliefs and all that, and oftentimes they're mixed if they're coming from their homeland versus somebody who's been kind of here for several years and their beliefs or are acculturated more. But at the end of the day, they kind of like iron out what's the outreach plan and what's the geographical area that we're talking about, who are the people we're talking about, and then how do we execute that? So it's very specific. I don't know if you want to add anything else.
Yeah, no, I think that was great, and I think just echoing that, a neighborhood to neighborhood approach. We have a regional team that cover different areas of the city. At the same time, they know that each neighborhood needs each plan, and we do have an ambassadors program where community leaders are able to work with our organizers, work with the community on a holistic approach, not just for vaccination efforts, so that they could get the skills that they need to make a change in their community. They have a capstone project. So really working, with each neighborhood, figuring out what works, what people are hearing, and then trying to find solutions or find a pathway to continue having conversations and to, hear people out, about COVID, about vaccinations, and direct them to the resources that they need.
Cool. Any other questions?
Yeah, with two hats, National Association of Hispanic Nurses in Philadelphia and New Viva Care Solutions. So I want to applaud everyone, government, as well as the community organizations that got together throughout this year plus for this effort, because it is a big, huge effort and undertaking. And as being part of it, I was part of the homebound program with RCAP, Temple, University of Penn, and Mainline Health to do in-home vaccinations and treatments for COVID, which was very eye-opening. So I understand about trust. It is important. Me coming in from Philly, that's why I chose Philly to do this effort, because I am from the neighborhood and I feel like that was really important, and they did open their doors to me to allow them to do that. But the question that I had is, how can we as the Hispanic Nursing Organization partner with you guys to be able to continue this effort as an organization?
Just email me.
I'm sorry?
Just email me.
Just email you.
We'll talk more after. But yeah, we can talk more and see what we can do to get your efforts and Kalei's efforts, because Kalei is a queer, trans, Black, Indigenous people of color. So again, we would love to work in the experience of expanding those embraces and making sure we're embracing not only the Latinx community, but also encompassing those other aspects with Kalei.
And for Philly Counts, we do have a coalition organizers that focuses on the Latino community, and I myself are very invested, both of us, in making sure that we're working in Latino community. So if we could figure out a partnership to move the work forward, I think that we found that it's community trust, but also having that healthcare approach where like people can ask questions. We can only, build trust, have conversations. We want to make sure like that, the healthcare side can answer those medical questions. So definitely interested in a partnership.
Vanessa will work with you to ensure that we're working with the health department, because obviously that's the medical piece. So we're kind of like the conveners to make sure that the collaboration happens.
So we used to do every year, and I'm sure we'll continue doing it, the immunization program for influenza as well as the pneumococcal vaccine. Will there be opportunity to do the COVID vaccine as well in that effort?
I think that's something we would take definitely back. We have relied on partners through MOUs, that's how Esperanza started doing our testing in Congresso, while making sure that those memorandums of understanding happen through the health department. So we could definitely take your information, Valerie, and make sure that we follow up with the health department and make sure that put you in contact with the right person, for sure. Especially if we're going to have boosters, because that's up in conversation right now. So again, we know that it has to be multifaceted.
Any other questions?
Misha Rodriguez from APM. I was curious about any takeaways moving forward, kind of into the future, thinking about influenza for this collaborations that's been happening between the city, medical partners, and community organizations. I know has been really essential. And I know at APM we've learned a lot about the importance of really formalizing these relationships and moving forward. And we've talked a lot about how using that for influenza and other public health campaigns in the future will be really essential. So I'm wondering about any takeaways that we've all learned.
I think this past year really solidified the importance of partnerships, and I think it's something we'll continue. I'm grateful for the partnerships that we had pre-pandemic that were solidified and the ones that were new. One collaborative that we joined over this past year was the Latino Health Collective, and that has been really helpful for us to hear from other organizations serving the same community that we're also trying to serve, to hear what they're hearing and see where collaborations can occur. And so I think we'll continue to try to be as involved with the different partners in our community, different collaboratives, to see how that may help our community when entering into next season.
Well, I think if there's no other questions, I think we'll wrap it up again. Give yourselves a round of applause. I'm sorry I did it a little early, but thank you all for coming. Thank you all for this conversation. Yep, and have a wonderful day.